Canada has the worst healthcare system, and I really mean it. I never said it out loud, but yesterday's incident has forced me. 2 days back, I had this sore throat, and it was bearable, and cough and cold. So I was like, it's common allergy or something. I was taking anti-allergy, I was taking cough medicine, but yesterday in the morning, it started. I had a lot of chest pain. I had a lot of sore throat. I was breathless. I am an asthmatic patient. So I called, and my three kids were also coughing along with me. So I knew, like, it's an infection that has spread to all of us. And I was coughing greenish sputum. So obviously that had started into a bacterial infection. So I called up my new family physician near me, and I've been going to him for the last 2 3 times, and because he's nearer to my new place. So I called him up. They said we are fully booked. It's a walk-in clinic, and he is my family physician, new one, and he's saying I'm fully booked. Go to some other walk-in clinic. Anyway, I told the nurse that if you are my family physician and you're not accepting me, how do you expect other walk-in clinics to accept me? Anyway, she's like, the doctor told me that I won't be accepting any more walk-ins. So I can book you a telephonic consultation. I said, I need to be checked because of my asthma, because of my chest condition. Anyway, they told me call other walk-ins. I started calling 7 to 8 walk-in clinics near me, and they were all fully booked. Like, walk-in clinic is not a walk-in clinic at all. You cannot go there, and you cannot go to the emergency department because they will make you wait 7 to 10 hours minimum. This is the minimum in Ontario, and they will only check you if you are dying at their premises. If you are in a very, very serious condition, if you're having a heart attack, or if you are literally dying, then they will come and check you. They will give you the best treatment. Even when it's your turn, they will come to you, they will check you, they will do every possible thing, they will satisfy you and send you home. But to get to that examination room, it will take you 7 to 10 hours minimum. To cut the long story short, I called 8 to 10 walk-in clinics, and nobody was accepting me. They told me they are fully booked and they can book me for next day's appointment. And I couldn't wait that long. And I couldn't go to the emergency as well. As you know, that the emergencies take 7 to 10 hours minimum. So what I did, I called up my old family physician, and I did not call them up. It is 20 to 25 minutes away from my place. I drove there, and with three kids, I drove there. They told me, okay, fine, you'll have to wait for some time. I said, okay. My kids were with me, and they were also sick. We were waiting. Okay, fine. There were patients who were just fine, normal. They came for normal routine checkups, and I was in this condition. My kids were coughing. We were coughing, and I was breathless. Anyway, after waiting for quite a long time, almost it was 6:20 p.m. I went to her. I went to the receptionist. I told her, can you nebulize me? I'm having a lot of chest pain. And so she said, no, I cannot. The doctor will have to check you. I said, okay, can you tell the doctor? Can you request the doctor to check me and nebulize me? And he said, no, if he checks you, he will have to check all of you, and that will take a lot of time. And you are a walk-in, you have to wait for your turn. I was like, anyway, I said, I can wait for them to be checked at the end. You check me at night. Make me wait all that hours, but at least check me and nebulize me. Anyway, she said, okay, I will ask the doctor, but I knew by the way she said, she's not going to check me. I'm talking about the clinic on Bloor Street, Family One Medical Center and Pharmacy. This has been my old family physician, family clinic. So I went there, and I knew if I call them up, they will tell me that they are fully booked. So I just stepped in. Anyway, then this happened. So I was waiting there. Anyway, I remembered, okay, I can get my inhaler, Ventolin inhaler from the pharmacy. The pharmacy is inside the premises. Literally, like, this is the receptionist desk and this is the pharmacy desk. So they are inside. So I went to her. I said, can you give me my prescription of Ventolin inhaler? It's a re-prescription. Doctor has already prescribed before. She said, okay, you will have to wait for the doctor to prescribe. I said, it's a re-prescription. And I'm an asthmatic patient. I've already been prescribed this before, some months before. So she said, okay, this is a prescription, but it has to be signed by the doctor. I said, okay. She said, go to the receptionist, the same receptionist, and give it to her, and she will get it signed by the doctor. I gave it to her, and it was 5:30 p.m. by that time. I went to her. I said, I can't breathe. Can you get me this? Can you get this signed? Just a sign from the doctor. Anyway, she told me, okay, you can go and wait. And we were sitting in the room. She had transferred all of us to the room, to an empty room, because my kids were like, they were crying, they were cranky, so they had shifted us to a separate room, and I didn't know what was going on. So whenever I came to the main reception area, I saw new faces, new people sitting on their phones, spending, like, literally in a normal way, because they were normal. They had normal appointments, but these guys were not willing to check me or prescribe me anything. I don't know why. Anyway, so after almost 1 hour had passed, I got a call from my new current family doctor, and he said that you booked the telephonic consultation. I said yes, because you were not accepting me online. Sitting in the clinic, I talked to my new family physician, and he prescribed me inhalers, sinus rinse, and I don't know what not. Anyway, so I told him he told me which pharmacy. I said, obviously, the Costco pharmacy. Anyway, so he wrote it, and 1 hour had passed. This receptionist had not come to me even with a signature for the inhaler. So my husband had also reached by that time. So I said, okay, let's go to Costco pharmacy now that the new doctor has prescribed the medicines over there. We went to Costco. Somehow, because of some technical problem or whatever problem, the Costco did not receive my prescriptions. And by that time, it was 7 p.m. Now I started getting calls from the clinic where I was sitting after so many hours. So they did not bother to come check me. They did not bother to nebulize me. They did not bother to just sign on my inhaler, and so that I could get acute relief. And anyway, I had left because I had the telephonic prescription from the other clinic. I went to Costco. Costco did not receive my prescriptions. I was sitting there. They gave me a number of Rocket Doctor. There is some online Rocket Doctor that they told me to call. I called them up. They said, we are fully booked, and you have to book appointment for tomorrow. I said, I'm at the pharmacy. I require my inhalers, and they said we cannot do anything. Anyway, at Costco, there was no doctor, no pharmacist. They said, we don't have your history. You have not taken the inhaler from us. We don't have a centralized system. If you buy something from even other Costco pharmacy, we will not have the history with us. We cannot check. There is no centralized system which can check your medicines, which can check your prescriptions. Wow, we are living in like 2022, and we don't have a centralized system here. Anyway, so it was around 8:30 p.m. I told my husband, I had started having fever and shivering. I told my husband, let's go home. Let me take all the medicines we have at home, see what we have at home, and just take me home. I couldn't go to the emergency room because the emergency room, as you all know, they will not treat you until and unless you are dying at their premises. If you're dying, if you are having a heart attack, at that time they will check you, and they will give you like 200% care. They will satisfy you, they will check you for all, they'll do all the tests. But for that, you have to reach up to that dying stage. Anyway, so we came home. I literally searched the whole house for my inhaler, and I had 4 to 5 puffs left from my previous one, and just the Ventolin one. I took that and I survived the night with that. And now I'm going to this new family clinic again because somehow they have not called me. I don't know if my complaints are to the government or to OHIP or whoever is concerned, the Ministry of Health, whoever can take this seriously. I had a hell of a night yesterday. And if you can centralize the system at least, and if you can increase your healthcare support and system, and I don't know, whatever you can do, it would really help the patients. So thank you for watching and take care and bye bye. And no, I'm not crying all this time. I have this bad sore throat.